conversation brought to you by Marcus and Mack, a law firm representing injured people. Heather, good to hear from you.
Hi, Todd. Good to hear from you. Good to hear your voice. Human beings, right? It's all good.
Yeah, humans speaking. Unfortunately, folks can't meet face-to-face that much anymore, but we do still have these telephone devices, and so we can find each other in some way or another. And we're glad to be able to talk with you today. Of course, you and the folks at the Indiana Regional Medical Center, you as the executive director of the Indiana Healthcare Foundation have the opportunity to see every day how hard and how creatively the folks at IRMC are working on this COVID-19 pandemic. It's pretty inspiring, isn't it?
It sure is. These are definitely uncertain times, but to see the way our staff, and, we talk about our frontline staff, but it's so much more than just our nurses and our doctors. I mean, we're talking about the food service workers, maintenance, housekeeping, the lab, respiratory therapists who are working round the clock, regular therapists. It is a total team effort, all hands on deck, and I've definitely seen, some creative ways to just use existing materials and find the best way to protect both patients and employees. But definitely, it has been amazing to see our hospital family come together in a time like this.
Yeah, really is. And you highlight the fact that it is really the entire community at IRMC that works on this. And they have some very, very difficult challenges, even more so than we do in the general public because of their proximity to, they're right there at ground zero for COVID-19 here in Indiana County. So they have to take extra special cautions with what they are doing and still get the job done.
Absolutely. I mean, the reality is when we're inside the building, inside the hospital, social distancing doesn't exist. I mean, we're providing interactive patient care, and so you have to find a way to protect yourself and your patients when you're in that proximity, that space. That just, when you're providing care, just can't be avoided. So and that's been a big piece of where the community has certainly stepped in and stepped up. We put out an initial, a call and an appeal letter to the community asking for some donations. And oh, my word, Todd, has the community ever come through? I mean, it has been weeks of just being inundated with the most gracious gifts and donations, but definitely masks and N95s and hand-sewn masks and surgical masks. It just continues to overwhelm us, just the level to which the community has answered that call for PPE and for everything else. The donations of food are coming daily, snacks. It's been very overwhelming in a really, really good and humbling way to see the community sort of step up and look for a way to help and just really meet the needs of our staff during this time.
Sort of like a socially distant hug from the community to IRMC, huh?
That is exactly right. It's been amazing, and it has. I try not to be a crier, but in my old age, I've certainly become a crier. I've definitely been brought to tears on more than one occasion throughout this. There is a Facebook group out there called the COVID Avengers, and every single day they get new members. People who have 3D printers are joining this group, and they're printing face shields for all of our staff and for other staff throughout the community that are in the front lines. I've cried on numerous occasions just seeing children. I mean, there are children who are printing, face shields for people. It's just given. It's us raising up a generation to show that you can do something that's bigger than yourself. So it's been honoring to sort of watch all of this unfold.
Heather, take us inside the atmosphere at IRMC. Of course, it's a much quieter place now because of some of the precautions that are being taken, some of the procedures that are not being done. But as a release just a couple of moments ago from IRMC tells us, the hospital reminding everybody that we're still here, and they're here for you during this challenging time. It's still a full-service medical facility, and folks can get their testing done, and the services of the hospital are still available to folks. But inside, it's a whole different atmosphere, isn't it?
It is. We're really, really taking precautions. While I said when you're providing, face-to-face patient care, you can't social distance. But outside of that, we are taking all precautions necessary within the hospital and within departments to practice social distancing. There is no gatherings in hallways. You're not really seeing gatherings in the cafeteria. You're just really seeing departments kind of stick together and try to keep just all of those precautions in place so that we're doing our part to make sure everything is safe and sanitary, and that, our patients, which are number one, are really the most protected while you're in the hospital.
Telemedicine has become a really big aspect of what IRMC is doing right now. That takes a cooperative effort by the staff as well, because, in a very quick time, telemedicine became a really big part of what IRMC does, and it took some work to make that happen.
It sure did. And, honestly, there is obviously a learning curve on behalf of staff and physicians. I personally got to jump in a telemedicine call with our pediatrician, and, that's a learning curve for them, too. But honestly, it was super easy and simple from my part as a parent. And I felt super comfortable that I didn't have to leave the comfort of my own home. But, you have to make sure you have the necessary framework in place in terms of preventing cybersecurity. That's a big thing right now. We're seeing lots more on people, unfortunately, trying to take advantage during this time and hacking into, systems. So that was a big thing. Our IT department, Mark Volovic and his team, really at the ready and led that effort to really get that up and running. And so, kudos to them for making sure everything came online and, is hopefully running seamlessly to help our patients and our community right now.
So from your standpoint and from the Healthcare Foundation's standpoint, I know you're impressed, but I know you're very, very grateful for all of those people. If you had to speak on behalf of the foundation to both IRMC's staff and frontline employees and to the general public, what would be some of the things that you would want them to know?
I want our frontline staff, and like I said, that includes all of them, to just know how grateful we are. They're coming to work every day, Todd, serving our community, but they also have families. They also have the same amount of stresses during this uncertain time. They have to go home at the end of a shift, worrying about, am I carrying something home to my children or my husband? Some of them are caring for elderly parents still. Some of them might have had a spouse that lost a job. They're worried about childcare. So from the foundation perspective, I want our frontline staff just to know that we really do appreciate everything they're doing, and all the efforts they're making. And from the community standpoint, just what a generous and amazing community. And I'm just so beyond grateful to every single day, Todd, I'm on the phone. Someone is calling to ask, what can I do to help? What is it that you need? How can I help you? How can I write a check? Where can I mail a check to? Where can I make a donation? And it really makes me at least feel like I'm doing a small part to help coordinate this effort and to do something to ensure that we have the proper, equipment and sanitizing supplies, and we continue to step up that effort from that side too. So yeah, it's just a message of hope and generosity and gratitude from the foundation.
We talk with school administrators, with healthcare professionals, with people in every walk of life, police agencies, and everything about this COVID-19 and how it became an emergency so very, very quickly. And people had to spring into action and to do things that they probably never expected that they would have to do. As this spring progresses, as the months begin to come along and we continue to look at measures that have been taken and hopefully at how this situation finally eases, we'll be taking lessons from what happened here in March and April and probably May of 2020. What are some of the lessons that you anticipate that from a foundation standpoint you can look at and learn from so that in the future it can be even better in terms of the way that we respond to crises such as this?
I think just that whole preparedness, and honestly, living in a rural community where our community hospital was on solid financial footing, governed by an amazing board, and the boards that came before us, setting us up to be in this position. We were prepared, and the fact that this virus in particular slowly rolled out to us gave us even more time to prepare and be ready. And so, I think from that standpoint, it's just a lesson in knowing that we were there. We were ready to face this full on, I think even more so than many of our counterparts were. So, this community should feel really good that we responded, and we responded so quickly, and we were prepared, and we continue to just, make sure that we are prepared, for what might come, or what if that surge comes here, just continuing to make sure that we're on the ready. And I think as we move forward, that's something you're going to see, just our effort to make sure that we continue to serve the community and work here no matter what.
Yep. You have to apply the lessons of today to make tomorrow better. Heather Reed, thank you so much for spending time with us today.
Sure, Todd. Thank you so much for having me on. I'm happy to express our gratitude to this community and to all of the staff that are out there. So it's been very humbling. I'm honored.
Have a terrific day.
Thanks, Todd. You too. Take care.
Bye now.
Bye-bye.
There's Heather Reed from the Indiana Regional Medical Center, from the Indiana Healthcare Foundation. And it is the voice of Indiana County at WCCS, AM 1160, 101.1 FM, 101.1 FM.